In our review of the male pelvis and the male reproductive system, let's go over the route that the ductus deferens takes from the scrotum to the urethra, to where it joins up in the back of the bladder into the prostatic urethra. So we'll start with these two views in Netter's. The view at the top is not a midline sagittal view. It is more of a just a little bit off sagittal, a little bit to the side of the sagittal view, and they've peeled away not only the skin but part of the bone here. So they've cut the pubic bone here, obturator foramen. And so there's a little bit of this pubic bone, and then you can see the sacrum and the coccyx, but it's a lateral side view of the coccyx and sacrum. So we're not quite at the edge of the patient, but we're also not midline. This is more of a midline view here on the bottom, where you can see the bladder and the urethra coming all the way down through the penis and the middle of the scrotum and the middle of the rectum. So that's a midline sagittal view. But we'll start here so that we can actually see the route that the vas deferens or ductus deferens, that's one and the same, that they take, and they are within the spermatic cord, which contains the ductus deferens but also contains some vessels. So here's the testes and sits outside the pelvic cavity, and they sit within the scrotal sac here, and there are two of them, one on either side. And the epididymis sits on the superior and posterior side of the testes. So this is the testes here and the epididymis, and at the bottom of the epididymis is where the ductus deferens attaches. And then it courses superiorly up through outside the scrotal sac and up toward the top of the symphysis pubis, and it goes anterior to the symphysis pubis through the superficial inguinal canal, and you can see that superficial inguinal canal here, and this is the ductus deferens running through it right here. And this courses anterior to the iliac vessels. So the iliac vessels here turning into the femoral vessels, this runs anterior to that. So the ductus deferens courses anterior to the symphysis pubis and just anterior to the femoral vessels, and then once it enters the pelvic cavity, it courses along the bladder, and it may be on the superior border of the bladder or maybe just a little bit to the lateral side of the bladder, depending on how full the bladder is. It continues to course posteriorly, running just anterior to the ureter. This is the ureter coming down here, so it goes just anterior to the ureter and then medial to the seminal vesicles, where it combines with the seminal vesicles to, it joins with them to create the, ejaculatory duct and go into the prostatic urethra. So then looking to the posterior side of the bladder, so you can follow the ductus deferens to its end point. We're looking at the posterior side of the bladder here in this lower left-hand image, and we have followed the ductus deferens around to the side of the bladder or above the bladder, just depending on how full that bladder is. And the ductus deferens, vas deferens, same thing, runs along the sides of the bladder, courses posteriorly and inferiorly, and then ends up medial to the seminal vesicles. So everything is in pairs. You've got ureters in pairs here. The ductus deferens or vas deferens comes anterior to the ureters, posterior to the bladder, and medial to the seminal vesicles. Here are the ductus deferens here, and the pair of seminal vesicles here. And the ductus deferens and the seminal vesicles are posterior to the bladder, but anterior to the rectum. So you will see them on a cross-sectional image. They kind of look a little bit fluffy. And we'll go over this in a lot more detail when we study the prostate. We're going to do a whole lecture just on the prostate, and so you'll get much more information there. But the ductus deferens, seminal vesicles come into the prostate here and form the ejaculatory duct and the prostatic urethra. And Cowper's glands are down here. So the spermatic cord contains the ductus deferens and other tissues like vessels. It suspends the testes and the scrotum to the inguinal canal. We'll get a really good look at the epididymis in the next slide, and also you'll have in writing the whole course of the vas deferens from the testes all the way up to the prostatic urethra. The seminal vesicles are located between the bladder and the rectum. We already discussed that. They're paired glands, and they're superior to the prostate. Prostate is here. They're superior to the prostate. Prostate is a fibromuscular gland, and it surrounds the prostatic urethra. It's inferior to the bladder, so it sits just below the bladder here. There are 3 zones of the prostate. There's actually 4. There's a fibromuscular gland as well, and it is a fibromuscular stroma, but I didn't list that one here. We'll go over that in more detail again, as I said, when we study the prostate. But the peripheral is the largest. It's the area where the most cancers occur. The central is more rounded section, and the transitional zone surrounds the urethra, and that is what tends to cause a lot of problems with urination. Here's a nice view of the testes, and you can see that the epididymis attaches to the superior portion of the testes. There is a head, body, and tail of the epididymis, and then continuous with the epididymis at the inferior edge begins a ductus or vas deferens, and then it courses superiorly up towards the Paupert's ligament and superficial inguinal canal. So here is the course all written out. Posterior epididymis, the posterior surface of the testes, continuous with the ductus deferens, begins at the inferior surface of the epididymis, courses superior along Paupert's ligament, which forms the inguinal canal, passing anterior to the external iliac vessels to enter the pelvic cavity. It then courses posterior, inferior, sometimes lateral to that bladder, either lateral or superior depending on how full it is again, anterior to the ureter, posterior to the bladder, and medial to the seminal vesicles, where it joins the duct from the seminal vesicles to form the ejaculatory duct and enters the prostatic urethra. When looking at the MRI or CT images of patients, in order to distinguish whether you are in a male or female pelvis, you can often look for pairs of things. When you see pairs of things, it's often male, and when you see a single item, it's often a female. So for instance, here you would not see these structures out here if it were a female. These are vas deferens. They run in front of the symphysis pubis. Symphysis pubis, really having a hard time with that one. And so you would not see this in a female pelvis. These structures would not be here. And there's a prostate, rectum, symphysis pubis. And then looking at a couple of other images. So here we are a little bit higher up. You can see the head of the femur here, and the sacrum, and the rectum, and bladder. And then in between you see 2 structures here, seminal vesicles. Maybe kind of hard sometimes to tell that's one structure or 2, but after a while you get kind of used to looking at the images, and you can tell that this is seminal vesicles versus the vagina or part of the uterus. And then here again, this was a CT. You can tell that the bone is bright white here, and the fat is darker. And then on this T1 weighted image of the pelvis, we're a little bit lower down here. You can see the head of the femur just a little bit better, and you can tell we're at the coccyx here instead of a little bit higher up in the sacrum. The rectum is a little bit smaller here, and then the seminal vesicles and bladder, symphysis pubis here. Orienting ourselves again, this is a sagittal view of the male pelvis. This is the penis and the scrotum and the symphysis pubis. You can't really see it here, but here is the sacrum and coccyx on the posterior side of the patient. Just anterior to that is the colon, the rectum, and anterior to that is the rectovesical pouch. It's a pouch between the rectum and the bladder. And bladder meaning vesicle, and rectum. So this is a pouch between them that can fill up with fluid sometimes, just as it did on the female pelvis. Here are the seminal vesicles. They combine with the vas deferens to create the ejaculatory duct coming in here to the prostatic urethra. So this area here of the urethra is called the prostatic urethra. Goes through the prostate. And then just below that is a membranous urethra, and that is right in front of anterior to and medial to the Cowper's glands. So if you're looking here at this image, there's Cowper's glands, the bulbourethral glands on either side of the penis, and just below or inferior to the prostate. And then the spongy or penile portion of the urethra is here. So I've got, again, the important items outlined in red. When you look at the penis itself, there is the spongy portion here on either side, 2 columns of that. And then that's the corpus spongiosum, and the corpus cavernosum is the cylinders of erectile tissue on either side. So that concludes our review of the male pelvis.